Good morning and welcome to A Glimpse of the Feminine. I'm your host, Tracy, and I was trying to think of what's the banter I want to have at the beginning of the podcast, and I came up with nothing. So we're just going to dive right in. February is Heart Health Awareness Month, and the week of the 7th to the 14th is always Congenital Heart Defect Awareness Month. Now, my brain just stopped working. Okay, so it's CHD Awareness Week. And so I wanted to take a little bit of time today and talk about congenital heart defects, or CHDs, and I'll show you a little bit about mine and Jay's story. The research on CHDs is not what it should be, and that's because there's a lack of funding. And there's a lack of funding because there's a lack of awareness. So in my own small way, over the last 16 or so years, I have been trying to raise awareness, definitely during this week of awareness, but around the calendar year, because this is what we live. CHDs are the most prevalent birth defect, affecting nearly 1 in 100 babies. Let me say that again. The number one birth defect is congenital heart defects. Now, how many of us were educated or even heard about the possibility that we could have a child with a congenital heart defect when we were pregnant? Now, I'd been having babies for about 20 years when I had my heart warrior. And other than the occasional, oh, so-and-so's baby has a hole in their heart, I had no idea what CHDs were or how common they were. And we hear about trisomy 21 or Down syndrome. We hear about spina bifida. We hear about all these other congenital conditions, but we don't hear about heart defects. There are approximately 35 recognized CHDs, and they often come in multiples, and they can vary from very mild to incompatible with life. So, for instance, when my Jay was born, his prognosis was incompatible with life without surgery. As I got more familiar with the heart community and got connected into some groups that were for his specific heart defect, there was a gentleman who was in his mid-50s and just getting diagnosed with the same heart defect that my son had. Obviously, his was not incompatible with life, and it had been mild enough, it had gone undetected for over 50 years. So that makes heart defects a complex issue. They also have varying degrees of frequency. Some, like ventricular septal defects or a hole in the heart, are pretty common. And that's why we'll often hear that, like, that's kind of what we're familiar with. Oh, that baby has a hole in their heart, or, and it's scary. It's a scary thing. The baby has a hole in its heart. But it is pretty common. The heart defect my son has, his main defect is Ebstein's anomaly of the tricuspid valve. So that's the valve on the right side of your heart, in between the right atrium and the right ventricle is the tricuspid valve. And that particular defect is quite rare. It affects only 1 in about 210,000. So those kind of defects are harder to treat because they don't know as much about them. And there aren't, the doctors and the surgeons don't have the experience with them because they are quite a bit more rare. Now, I did say main defect. He has Ebstein's anomaly and he has pulmonary atresia, which affects the pulmonary valve. Many times, CHDs happen in multiples. Only about 50% of CHDs are diagnosed prenatally. That is up. Several years ago, it was only like 35%. So that has increased. And that's partially because not every pregnant mama has an ultrasound. And it's partially because ultrasound techs aren't taught to take a close look at the heart. And this is important because for children like my Jay, if we hadn't had a prenatal diagnosis, we probably would have lost him. Because we had that prenatal diagnosis, we were able to deliver in the children's hospital, and he had immediate access to the pediatric cardiology team. They were already familiar with what was going on with him because we had done all our prenatal care there. And so that it was life and death for him. And it was life because we had that prenatal diagnosis. Now, for me, CHD means that I have never held my child without a scar. There was no snuggling my newborn as soon as he was cleaned up after he was born. There was no holding him and nursing. Jay was born by emergency C-section, and when they delivered him, he was dead. Thank God I was clear out. I don't know that I could have handled hearing all that as they delivered him. The doctors worked hard, and obviously, because I'm talking about him and I'm sharing today, he was able to be revived. But his APGARs were 0 and 0. And then by the time I was awake and out of recovery, he was intubated and sedated in the NICU. It was days before I even saw his beautiful little eyes. Jay was born on a Friday, and so we had different doctors over the weekend. And I don't know that I would have said they were cautiously optimistic, but I did get a little bit of hope from them. Monday morning rolled around, and the cardiologist that we had dealt with the most prenatally came in and sat down with us. And I said to him, so he's doing okay, right? And he looked at me and shook his head, and we had a conversation with him that no parent should ever have to have. Jay's prognosis was incompatible with life without surgery. And he sat down with us and lined out 3 or 4 different options. There's this surgical option, but it's not a great one for Jay because of this. And there is this surgical option, and that's not a great option for Jay because of this. And we could do this surgical option as well, and that's not great for him because of this. And then there's palliative care, and that really might be the best option. Now, I'm a post-surgical postpartum mama. And we'd already buried a baby. And I just looked at him, and I say I was hysterical. I wasn't loud, and I just was weeping uncontrollably. And I looked at him and I said, "Have you ever buried a baby?" And I got up and I walked out of Jay's NICU room and went back to my room. And I had an online friend who had had a daughter the same year that we lost our son. And she had the same heart defect that my Jay had. And they had lost her at 6 weeks. And so I called her. And I said, "I need to know. I'm certain you guys had the same conversation with Catherine's doctors. Why didn't you do surgery?" And she went into the reasons that surgery never happened for Catherine. And so when we sat down with the surgeon, and that's the other thing, we had been told, even if you decide on surgery, the surgeon may not agree. So when we sat down with the surgeon, he actually came in with surgical plan in hand. And also the caveat, he may not survive surgery. There's at least a 25% chance this baby will not survive surgery. And I said to him, 75% chance of survival is better than 0. Alls we're asking is give him a chance. So we started down a surgical path for my son that is called single ventricle palliation. So he's had 3 open heart surgeries that have incrementally rerouted his circulation. So in a healthy, normal circulation like you and I have, well, I'm assuming you have, you may be palliated to single ventricle as well. In a normal circulation, the blood is pumped out of the heart into the body. And then as it goes through the body, it returns to the heart through the vena cava. The superior and the inferior vena cava return the unoxygenated blood to the heart, and then it's pumped into the lungs where it becomes oxygenated, and then back to the heart and out to the body. In Jethro's circulation, that vena cava blood bypasses his heart. So the right side of his heart is excluded from his circulation now. That blood flows passively to the lungs, where it is oxygenated, goes into the heart, into the left side of the heart, and pumped out to the body. So this is also referred to as the Fontan circulation, because the Fontan is the last of those 3 surgeries. This circulation is hard on all the organs of the body. The perfusion is not what it should be. So quite often people with Fontan circulations end up with liver disease. As a early teenager, he already has the beginnings of cirrhosis of the liver because of the circulation in his body. He also has varicose veins already. So that's fun, trying to get a teenager to wear support stockings. Thankfully, compression socks are a fairly common thing anymore, but getting him to wear them is a challenge. CHDs also mean that your baby may not survive. CHDs are the leading cause of death in infants. The more medicine advances, the more research there is, the higher that survival rate becomes. However, unlike cancer, and I am not downplaying cancer. Please do not hear that. But unlike cancer, for a child with CHDs, there is no remission and there is no cure. CHDs is a lifelong thing. Even if it was a mild CHD, maybe a hole in the heart that they're able to repair, that child still is going to need lifelong cardiology care. Even kids that get a transplant and they've got a new heart, no more CHD. Transplants are not cures. Transplants create a whole new set of issues. When Jethro was just a few days old, we dedicated him. Now, in the NICU, standard rules, procedures, is one parent and one visitor. And that's it. You get two people in the room and one of them's a parent. So when we talked to them and let them know that we wanted to dedicate him, this is how you know things look really bad. We were allowed, I think we had between 20 and 30 people in his little NICU room the day that we dedicated him. That's when you know they really don't expect your baby to live. If your baby's in the NICU, you want for them to hold fast to the rules, because that means that your baby's really doing pretty okay, even though you're in the NICU. They start loosening up the rules and allowing things that they don't allow, and you know that things are bad. His first surgery, he was 10 days old. At this point, I had never held him. He had been hooked up to tubes and wires and monitors and all kinds of stuff. And I had never held him. And we walked him down to pre-op, not knowing if we would even see him alive again. In retrospect, I would have insisted on holding my baby. Because the reality is, he could have died, and I never would have held him. Thankfully, that didn't happen, and I don't like to deal in what ifs, but I share that because there may be somebody listening that is carrying a baby with complex congenital heart defects. And I just want to say to you, Mama, especially if things look grim, make them let you hold your baby before that first surgery. Now, Jethro did come through his surgery, and it was, man, those first months, were rough. Rough. We were in and out of the hospital like multiple times. In his first 3 months, we probably spent about half of his first 3 months in the hospital. He was 5 weeks old before he was discharged for the first time. And he was 2 weeks old before I ever held him. And man, was it a production. Still, wires, tubing, all kinds of stuff. He could not be disconnected from the monitors. And it was a major production for me to be able to hold him. And I sat and bawled. And I held that baby for hours. We don't realize what we take for granted with our healthy babies until we have one that isn't. A simple, normal thing like holding my baby and rocking him. And it was the most glorious thing in the world. CHDs also mean that there are therapies. There's feeding therapies, there's occupational therapies, there's all kinds of therapies. We had therapists in our home on a weekly basis for a long time. Before that all got set up, I was making multiple trips up to our children's hospital multiple times a week for all kinds of therapies and doctor's appointments. And we just practically lived at the hospital even when we were not inpatient. He was on oxygen 24/7. He was on a feeding tube 24/7. And we were just thrown into the deep end of the medical pool. He was on Coumadin quite a bit when he was little. And so there were multiple trips to town to check his INR. And it was overwhelming. We he was about 10 days out from his first open heart surgery, and our house burned. So we were dealing with insurance and getting the house torn down and rebuilding, and I was making multiple trips to town every week, probably 3 or 4 trips to town a week, and had other children, and life was overwhelming. And it's okay. If you're in that season and you're overwhelmed with your heart baby and all of their care, in addition to life going on, and it's overwhelming, it's okay. It's okay, Mama. Take a deep breath. You've got this. The treatment of CHDs has improved so much over the years, and that means that more and more children are making it to adulthood. That became a problem because regular cardiologists don't know how to deal with congenital hearts. A congenital heart and a healthy heart that has become diseased are 2 totally different things. And so now there is an adult congenital heart specialty. And thankfully our area has one of the first programs for adults in the country. The other problem that we run into as parents of kids with heart defects, and that kids with heart defects run into, is there has been so much, understandably, the focus has been on let's get these kids to survive, right? But now that they're surviving, we've got kids and adults that have PTSD from medical procedures, and a lot of parents are dealing with PTSD from having a baby in the hospital. Thankfully, I was kind of able to work through all of those things as we were living them. And so I don't have PTSD as a heart parent. And one of the things that we did with Jay is I decided almost immediately, this is his life. And so we need to treat everything as normally as possible because this is his normal. And so even when he was a baby, we'd go to give him medicine. And if one of the other kids went, "Ooh, that's medicine," I would say, like, this kid is likely going to be on medications his whole life. I do not want him to associate medicine with ew. That's mostly worked. There are some meds that we still have. Thankfully now he doesn't have to be on prescription medications. That may change at some point down the road, but at the moment he does not. But when he was littler, he did. And really, truly, the only meds we've ever had issues with him are antibiotics. And the doctor's visits, we would always make a big deal about going, oh, we're going to go see doctor. Hey, we get to go see the cardiologist. And if we were at the children's hospital for any reason, we would go up to cardiology just to say hi. Because I wanted all of that to be familiar to him and for them to be his people and for him to be excited about seeing them. And it worked. I'm sure some of that's just his personality, but after his Fontan, I think we were in the hospital for a couple of weeks. We never seemed to be able to just have like an in and out hospital stay. And by the time that visit we were discharged, he was done. If anybody walked in and they were not in street clothes, any sort of scrub or doctor's coat, he was just off the rails, scream and cry. And I thought, oh, we've ruined this kid. All my hard work is gone. And he had fluid on his lungs. So they discharged us, but we had to go back for x-rays and stuff so they could keep an eye on it. We did end up with a readmission for drain tubes and stuff, but we had gone up for to get some x-rays done. And I had forgotten to ask if they wanted us to come up to the office after we were done. So we just went up because we were there. And one of the MAs came out of the back and I said, I didn't know if we were supposed to come up or not. And so I just thought, we're here, we'll run up. If we don't need to be here, no harm, no foul. And she said, well, let me go see. And she looked at him and she said, I've got some goldfish in the back. Do you want to come back and get a package of goldfish? Is that okay, Mom? I said, oh, yeah, that's fine. And he just left me. He left me standing in the waiting room all by myself. And I thought, well, I guess we didn't ruin him. So he has global brain damage because he was dead when he was born. And he had very low oxygen saturations, especially the first 6 months of his life, which is one of the reasons we were in and out of the hospital so much. And until he was about 5, he sat in mid-70s. At 5, they closed off a fenestration or an opening they had left that kind of acted as a pop-off valve when they did the Fontan, and they closed that. And now he sat mid-96, which is about where you and I sat. But we have struggled with not being able to handle a lot of sensory stuff going on. His brain damage is global, but particularly the frontal lobe was damaged. He's smart, and as he's gotten older and his brain has continued to mature, there's so much improvement. But a lot of these kids deal with these kind of issues. They might have learning disabilities. They might have sensory issues. Some of these things, brain injury often presents in a similar way as autism. And so these kids need extra support. And now it's not quite there. This generation is kind of pioneering the mental health support aspect of congenital heart defects in the same way past generations were kind of pioneering through the physical health part of it. And so we need to get that in place for these kids. And it's so hard as a parent because it feels like you're reinventing the wheel for your kid. You know you're not really, but it feels like that because the recognition for the need for services isn't necessarily there yet, or we're just on the cusp of it, but the resources for that help isn't necessarily there. Which is one reason why awareness becomes so important. I've already thrown the word palliation around a little bit. And if you're not familiar with that term, like hospice care is palliative care. And a lot of times that's the only understanding of palliative care that we have is hospice. But really what palliative care means is that there's no cure. All we can do is try to give the best quality of life while there is life. So really, all kids with CHDs, especially if they're CHDs that require surgeries, and not all of them do. There are kids with my son's defect that haven't required surgery, but his was so severe, he just wouldn't have survived without it. But it's all palliative because we cannot cure or heal these defects. I don't know if this has been a very hopeful message or not. I want it to be. I didn't know from before he was born, we didn't even know if we were going to have a kid to raise or how long we would have him. Still don't know. You know what? We don't know that with any of them. That's just reality. But the reality of loss is just right in your face when you have a child with any sort of a congenital defect or cancer, or there are certain things that the reality becomes tangible. But I would spare Jay. I would spare him all of the hurt that he's gone through with the surgeries, the struggles he's gone through with his brain injury. I would spare him all that if I could. But man, is he resilient. And this whole thing has been so uncertain. What's he going to be able to do? He really struggled with rage for a long time, and I thought, what kind of life is he going to have? But as he's gotten older, that's gotten better, and we've been able to give him some tools to help manage, and he's wrestling. This kid functions on half a heart, and he's wrestling. And when I watched him wrestle last year, the world opened up. I never ever told him, no, you're not going to be able to do that. But I would tell him, we're just going to have to wait and see. I don't know. world opened up, the possibilities opened up. We have met some amazing people in this journey that I am so thankful for, the medical people, and I have met some amazing, some of them I haven't actually got to meet face to face, but I have become good friends with them online. Other heart moms, adults with congenital heart defects. This life has been a struggle, but it's also been a blessing. So, that's congenital heart defects in a nutshell. I will be sharing some facts. Some of them may be reiterated from this. I'm not totally sure. In the next few episodes for February, because this is obviously near and dear to my heart. And until next time, take care.